Enjoyed your presentation, by the way. So let me present, and you guys should be seeing my screen now. So I'm Dr. Henry Legere. I'm the CEO and founder of Reliant Diagnostics and our enhanced telemedicine platform, MDbox, that's been commercially available really since April. So pandemic kind of hit us sideways a little bit, but we pivoted and have end-to-end a la carte pandemic solutions, as well as our core telemedicine business that's really taken off in the last 6 to 8 weeks. In particular, in the last 2 weeks with signed contracts that I'll tell you about. By background, I'm a South Texas native, grew up between Austin and San Antonio, went to UC Berkeley, studied chemistry and economics, then Columbia University in New York City for medical school. Then I did an immunology fellowship at Harvard Medical School, and I stayed on faculty there. I worked, I had faculty appointments at Mass General, Boston Children's, and Brigham and Women's. And while I had a Harvard faculty appointment, I started the MIT Medical Immunology Division and was on faculty at MIT. And so about 13 years ago, moved back to Texas to escape the winters and started a series of medical practices, grew it to 23 locations in 4 states, still have an executive staff that runs them. And so I passively generate income that way. And about 5 years ago, I started MDbox and Reliant Diagnostics. And really what the goal was to be able to create a new telemedicine experience that was much more sophisticated than simple texting or two-way video or phone calls. I wanted providers on the other end of these visits to have access to the same quality of data that they would have in a live encounter with a provider. So medical grade images of the eardrum, the back of the throat, the skin, heart and lung sounds, bowel sounds. And it took a while and it took a little bit of effort, but we pulled it together. We successfully did a pilot with Walmart back in January of last year, 50 supercenters. And based on that, Walmart offered us a contract that would have gone live imminently in September of 2020. Pre-pandemic, that was the timeline, in 2,000 locations across the country. And we did a pilot with HEB in 70 locations in Texas. HEB is a dominant grocery store pharmacy in the state of Texas, similar to Stop and Shop in New England, or Winn-Dixie in Florida, or Publix in Florida. Based on that pilot, they offered us all locations, 274 locations with pharmacies that would have gone live again this October. And so we had not just those two, we had almost anyone you can think of. Brookshire's in North Texas, Walmart, Kroger's, in the Northeast, Ahold Delhaize, which operates Stop and Shop, Giant Martin Eagle in the Mid-Atlantic states, Southeast Grocers, which is basically from Georgia down to Florida over to Louisiana, Schnucks in St. Louis, Myers and Hardig's in the Midwest. And all told, we had signed contracts to be in 23,000 locations by the end of 2020. And based on that, we had a rollout schedule. Whoops, I think I just stopped sharing my screen. There we go. Based on that, we had a rollout schedule that would have started April 15th. And so, you know, the pandemic was becoming obvious to us in February. Early in March, we started getting on the planning calendars of these large retailers and asked if we were still going to be on track, because the concern was that they wouldn't want sick people with COVID walking through a drugstore, grocery store, pharmacy to do these enhanced telemedicine visits. And so we postponed most of our rollout. All of that is finally starting to get back on track. So now we're re-engaged. We've gone live in Food City with Hardig's next week, Topco, which is 2,300 locations that they are brand affiliates with. That goes live in the next month. And all told, Kroger's as well, all told, it should be about 10,000 locations live by Q2 of 2020. But, you know, we didn't just sit and rest on our laurels and wait.
Sorry, Q2 of 2020 or 2021?
Sorry, 2021. Sorry, I misspoke. While the pandemic was happening in the early months, so in April and May, we quickly adapted our remote patient monitoring platform to be able to do remote symptom monitoring for COVID. And we quickly integrated our machine vision system that can align with point of care tests to be able to give instructions for the PCR collection, whether by nasopharyngeal swab or oral swab or saliva. And then we partnered with manufacturers. And so we have rights of first refusal on a lot of that. And I'll get into that in a second. But we really did a pretty good job of COVID pivoting. And so we went from basically just starting in April with no revenue to we've closed about $5 million in business in the last 6 weeks, and we've got contracts in place for close to $100 million in business for the next calendar year, and I'll get into that in a little bit. But it's actually been a very it started out as a very dismal pandemic season, and we really jumped into a lot of big government contracts, and I think we're positioned really well to be a great buy for an investor at this point. And so what is enhanced telemedicine? What really sets us apart from all of the other telemedicine companies that are out there and the big behemoths like a Teladoc or a MDLive or an American Well is the fact that we took the time to integrate with these toolkits. And so we've done over 120 different Bluetooth devices that we've integrated with, but including TytoCare and TytoCare Pro. We're the only platform right now live on TytoCare Pro where this is holding the tools that make it capable to capture medical grade images of the eardrum, the back of the throat, heart and lung sounds. Based on that, we just signed a contract for 200 nursing homes yesterday. But the staff what really is so innovative about this is that you don't have to have expensive salaried doctors or even nurses to be able to turn on a new clinic. We can go into employers and their human resources designated person can train on our platform, become a telemedicine extender in about 2 hours. School nurses have signed on. We've signed the state of Alabama public schools to be able to turn every school nurse station into one of our sites. We've signed a contract with Injury Free. That's about 250,000 youth soccer players, another 20,000 youth rugby players, and the Big East, several different one-off schools like Crichton, Florida Atlantic, that will be doing their testing through our platform. And so we can very easily go there, figure out who the staff is that they have on site, and then pick the appropriate personnel to train as telemedicine extenders. Now, these big retail pharmacies we're partnering with, it's pharmacy staff. So it's either the pharmacist or a pharm tech. And they're better trained than a lot of the human resources designated health personnel we're dealing with. But basically what happens is we invite them then to a training portal, and they fill out all of the privacy and HIPAA training that they have to do. And we have quizzes, and then we show them how to use our software platform. We show them how to use our integrated point of care test devices, our machine vision. But everything is really operating off either a smartphone, an iPad, or one of these little toolkits. And so you don't have to lug around, it's something that you can easily fit in a purse or a backpack, and you've turned on a medical clinic. Prior to the pandemic, we already had visit types that we did in our pilots with general visits, medication refills, sports physicals, cold and flus, strep, allergy, rash, pink eye, vomiting, diarrhea, birth control, herpes, acne, hair loss. We're getting ready to launch colon cancer screening, HIV, chlamydia, gonorrhea, and then the pandemic hit. And so we quickly, our machine vision is sophisticated enough that it takes us about 3 days and 10,000 images to onboard any new visually read test. So the antibody test that's out there, we were able to align with and calibrate. We have our own lab in Austin, and then we have a high complexity CLIA lab that we partnered with that's in Chicago, at the University of Chicago. And so that allowed us to validate tests. And so we did our own internal lab validations over the course of about 3 weeks. We determined that there were 2 products that excelled. And interestingly, if you followed the media and the news that was happening during the pandemic, early on in late March and early